Hi everyone, it's MedMade Easy here. Wanted to go over a very common diagnosis that you are likely going to see as a healthcare provider at some point, maybe even daily, in different patients that you have. So I thought it'd be a good idea to give 7 info tips to begin. Now, one of the things that I first want to start with is actually start with a couple of questions. So you can take a moment, pause the video, and jot down your answers to these questions. As you watch the video, let me know, comment below how many of the answers you got correct. And if there was any alternate answers, go ahead and make sure to put that down as well. So let's talk about gout. Gout is basically a type of inflammatory arthritis that has a lot to do with high uric acid levels in the body. If uncontrolled, urate crystals can actually build up in joint spaces, and this can be extremely painful. So let's go ahead and get into our tips that you need to know as a healthcare provider. Patients who have gout should avoid foods that are high in purines. Too much uric acid in the body causes gout, and purines are a substance of animal and plant foods that your body converts to uric acid. If you can't flush the uric acid out through your kidneys, it can build up in the bloodstream and then be deposited as needle-shaped crystals in your joints. This is what causes the pain and the flares. Some different foods, including bacon, beer, organ meats, seafoods such as shrimp, tuna. Certain vegetables also are on that list as well. Avoid high fructose products like sodas, sugary juices, candy, things like that. There's also certain medications like diuretics that should be avoided because things like dehydration can actually increase your risk for the gout to flare. Info tip number 2. The most common body part that's affected by gout is the hallux, or aka the great toe, aka the big toe. Often patients who have gout will come in and they'll complain of their big toe hurting. And so that's a pretty common sign / symptom of gout. Tip number 3. Uric acid levels are monitored every 3 months after starting a uric acid lowering medication like allopurinol. Now, the patient may end up moving to every 6 months once they're more stabilized. This also depends on the provider who is treating them. There are also other labs that need to be monitored frequently and regularly. CBC, renal function, and liver function tests are usually drawn every 3 to 6 months. Tip number 4. Allopurinol is one of the most common medications, maintenance medications for individuals who have gout. It's typically started at 100 milligrams daily and then increased That's the goal, with the maximum being 800 milligrams per day. Allopurinol should also be given with food. Acute flares are often brought on after patients have either eaten certain foods or they have not taken their medications, and so if they're in an acute flare of gout, they're usually placed on things like NSAIDs, colchicine, and corticosteroids. They are also instructed to continue their allopurinol as well. Number 5. Cherry juice helps to reduce some of the symptoms from gout. Some studies have shown that cherry juice actually lowers uric acid. Number 6. Untreated gout may actually lead to renal failure. Tip number 7. Less estrogen equals more uric acid. Now, women typically will get gout more in their older years, and it's because basically they have less estrogen, and estrogen usually supports kidney function and the ability for it to process uric acid. This is actually from rush.edu. And yeah, so those are the tips, the 7 tips. Hope they were helpful. Now go ahead and take a look at the answers to the questions here and see how many you got right. Please comment below. And yeah, you guys enjoy. Make sure to click subscribe. Thank you for watching our channel, and stay tuned for more videos.